Welcome to Middlesex Moments, the radio program and podcast produced by faculty, staff, and students at Middlesex Community College. I'm Steve Minkler, the college's Chief Executive Officer, and your host for today's show. Middlesex Moments comes to you from the radio and television studios and the Center for New Media, located on the main campus of Middlesex Community College in Middletown. Health information management is a field where business, science, data analytics, and information technology all come together. Put simply, HIM is the practice of acquiring, analyzing, and protecting digital and traditional medical information vital to providing quality patient care. HIM professionals are highly trained in the latest information management technology applications. They understand the workflow in any healthcare provider organization, from a large hospital system to a private physician practice. In 2014, Middlesex Community College recognized the need for an increased career opportunities in HIM and launched an associate degree program in health information management. Today, joining me is Jill Flanigan, who's the program coordinator of Middlesex Community College's Health Information Management program. Thanks for joining me today.
Hello.
So Jill, tell me and our listeners, what kind of student are you looking for to enter the HIM program? Is this somebody who likes being around computers a lot?
Being around computers is an important piece. That most of the work that's done is very technology based. We have moved into an era of electronic health records, so we are managing electronic data in our roles. Additionally, someone who has an interest in healthcare, but maybe not an interest in doing direct patient care, and someone with good attention to detail. It's ensuring the integrity of medical information is a big part of the job. It takes a lot of attention to detail, and so those would be the attributes of a great HIM student.
Okay. And what kind of coursework does a student take in order to prepare them in this field? So if you're taking a student maybe with some of those basic skills, what are some of the things that they learn throughout the program that prepares them for a job in this field?
Well, health information management combines knowledge of the clinical environment with some knowledge of business practice and information technology. So the student's going to have courses where they're going to get familiar with that clinical environment. They're going to take courses in human biology, pathophysiology, pharmacology. They're going to learn about medical coding. And they're going to have coursework where they learn about the reimbursement models in healthcare organizations, and they will have courses where they will learn about database management and healthcare informatics.
Yeah, so it's a very broad-based kind of program. Lots of stuff kind of thrown in the mix there.
It's a great career for someone who doesn't want to decide on just one thing to do.
It seems like it. Now, you yourself have a background in this career. How did you get? What interested you in the field of health information management originally?
I originally got into the field after leaving the Navy. When I was in the Navy, I had worked in flight sick call and managed some complex records of flight status personnel, and that was kind of what led me to health information management. And then I received a certificate in health information technology and went from there.
Okay. And then helping us create the degree program here at Middlesex Community College.
Yes.
So the other thing we have here is also a certificate in health information management. How is that different from the degree program?
Well, the certificate is focused on the clinical coding aspect of the field, and it leads to certification as a certified coding specialist or a certified coding specialist for physician practice. And so that is an expert level coding credential. So the coursework in the certificate gives students that advanced coding practice that they need for that.
Okay, great. Well, we have to take a quick break, and when we come back, we'll learn more about the degree program and how HIM professionals are important to healthcare providers. We'll meet one of our community partners here at Middlesex Community College. You're listening to Middlesex Moments, coming to you from Middlesex Community College. Stay tuned. We'll be right back.
My name is Tahira Barker. I'm prior service Navy, currently Air Force Reserves.
My name is Vincent Murata III. I was prior Navy in the United States military.
I hope to graduate from here with my associates in biotechnology.
There's a lot of support for veterans specifically.
The veterans were quick to introduce themselves to me tell me that anything that I needed on campus or off campus, that they were there to help.
To be able to transition from military life to being your own person.
Welcome back to Middlesex Moments, coming to you from Middlesex Community College. This is Steve Minkler, together with my guest, Jill Flanigan, who is Program Coordinator of Health Information Management here at the college. And joining us, we have two additional guests. We have Jill's colleague in the Health Information Management, Elaine Ippolito, who is an assistant professor. Hi, Elaine.
Hi, Steve. Thank you for having me.
And also with Elaine and Jill and I is Karen Lawler, who's Corporate Director of HIM and Privacy Officer at Hospital for Special Care New Britain. Thanks for joining us, Karen.
Good morning. Thank you for having me.
So Jill and Elaine are both professionals in the field, but then got into teaching in a program like we have at Middlesex Community College. Elaine, how did you originally get interested in the field of HIM? What's your background?
Well, I actually started in HIM back in high school, filing emergency department reports at a local hospital. And during college, I worked part-time in the local community hospital. And I really enjoyed it. But I was going to school for English and got my bachelor's and master's at the same time. Was encouraged to go on for my PhD by one of my professors at the time. And so I took a year off and worked full-time at a large academic medical center in Boston and really enjoyed it. So then I struggled with the choice between academia and healthcare. I went on, decided to go into library science because I found the similarities between medical records and library science, that a lot of similarities between the two. But then when I got out, I wound up going back to my large academic health center, getting a job there, and staying on for 8 years, moving up, getting into the management in HIM. And then eventually decided I needed to get a credential because I realized I couldn't progress in my field. And got that and never looked back and went on to be HIM director, work in the practice, and then also worked in education as well, which is why I wound up here at Middlesex.
All right. And we're glad to have both of you here with this really successful program. And Karen, how did you get interested in this field, and what was your
I got to take a
trajectory?
trip back in time. When I was a senior at Wagner College in Staten Island, I was lucky to learn about a certificate program at Downstate Medical for record management. So I decided to extend my studies another year and attended the certificate program and enjoyed the fact that I could be in healthcare yet not interact directly with patients. Although I love our patients, it's just I wanted to be behind the scenes. And again, like you, I've never looked back. I've enjoyed a long and rewarding career in the field. And I, too, also teach and participate in teaching our students and host students from the program as well. To me, it is probably one of the most rewarding careers that we can have in healthcare as we help our physicians, we help our patients. Patient engagement is critical, and interacting with a program such as this to bring professionals into our organization, much needed. Training is critical. The attention to detail I can't overemphasize, particularly now as we're looking at insurance that is very complicated for our patients, insurance that is very complicated for our healthcare systems, and to have trained professionals with that eye for detail that Jill mentioned is so critical. I can't underscore that.
Okay. Well, and Jill, earlier we talked about the kinds of courses that students take in this program, and a lot of that, the way that the courses are constructed is based on the experiences you all have had in your backgrounds and your education. But more importantly, we've got external people who kind of put their stamp of approval on this, and we recently got some fantastic news about the degree program.
That's true. We recently received accreditation of our associate degree program from the Commission on Accreditation of Health Informatics and Information Management Education. And this accreditation means that our associate degree graduates can sit for the American Health Information Management Association's certification exam. It's called the Registered Health Information Technician, or RHIT.
And CAHIM, as they're the shorthand for them, is
Right.
known as, they also help inform what our curriculum looks like in many ways, right?
They do. In order to receive accreditation, we had to make sure that our curriculum met their guidelines. So they have a set of outcomes that we have to make sure that we include in all of our courses. And we were assessed for meeting those, and they found our program does meet that criteria, and we received the accreditation.
That's great. And I believe we are the only accredited two-year program in the state of Connecticut.
We are the only accredited associate degree program in the state of Connecticut, yes.
And Karen, as an employer and as a partner with Middlesex Community College, how important is it to you to know that a student is graduating from a program that has this kind of accreditation, but also leads them to have these external credentials in the field?
Well, Steve, it's very, very important to us, particularly now. Healthcare is so complicated, and to have a trained professional coming out of an accredited program is critical, because we have a depth and breadth of services that we offer in health information management. It's not just managing paper anymore. We are very involved in data integrity with the electronic health record, very involved with assuring appropriate reimbursement for our services that we render to our patient. That's a fair and equitable and honest service that we're offering. We help our patients understand their health information. So having a person come out of an accredited program that has an experience not only with the teaching, the curriculum, but also the sites that they visit to learn more about different facilities is very valuable to us. Particularly now in our healthcare system, we're growing. And we're adding new services, we're increasing our service lines, and I will probably be looking for new professionals to join us.
That's great.
And I think, too, the credential shows your competency.
Yes,
that,
it does.
So you can graduate from
Absolutely.
a program and not get a credential, but the fact that you pass the exam shows the excellence, speaks to the excellence of the program as well as
It does.
to your knowledge.
It does, and the aptitude of the student to learn,
Sure.
because it's a continuous learning environment.
And it's almost like it's 3 seals of approval. You have the college awarding a degree or certificate, right?
Right.
And you've got the RHIT exam that awards this, but also the fact that we are accredited as a third
Exactly.
stamp of
It
approval.
ensures the
Exactly.
quality.
Yeah, exactly.
Yes.
So Karen, with the kind of information that an HIM professional is using and is responsible for in a healthcare setting, how does that person then contribute to analyzing this data for either efficiencies or compliance?
It's an excellent question. And I can go through every different facet of what we do. If we just take example, particularly the certificate program for coding, for the person analyzing the documentation in the record, being able to glean all of the information that would be important to present on a bill, coding it using statistical analysis, and presenting the accuracy of what exactly we service the patient for, and getting the reimbursement for our services. Very critical now in healthcare as we continuously look at our bottom line, our revenue. Hospitals are a business. We are in a patient care, but in order to provide patient care, we need to make sure that we are assuring the correct revenue and having the confidence in our staff that does that. Also, our coding professionals will help our physicians understand how their interaction with patients, conversations about the treatments, their documentation, all makes that medical record so critical and important for that patient.
Okay. And I guess a question for any of you. Once a person goes through a program like the one at Middlesex Community College, gets their credential, gets employed, what kinds of continuing education is necessary to maintain currency in this field? I'm sure these things are always changing around us with different requirements from the government or insurance companies. What kinds of continuing ed is necessary?
Well, it's an interesting question now, because October 1st marks when the codes change that we assign for reimbursement. I know we're concentrating a lot on reimbursement, but it's very critical then that we offer our students and our employees that education that we can get from our programs, and that is very important. Also, all of the rules and regulations that constantly change. With patient access to their information, we've heard about HIPAA, right? Privacy. So we have to constantly make sure we're in a learning environment and we provide that learning to our students as well as our employees.
Okay, thanks. And Elaine, our program is set up such that students can take most of their courses in online format. And as one of the faculty members in the program, and you teach online,
Correct. Yeah.
How does that flow to both a student and to the instructor in an online environment? I would think that that's, for many people, that might be a new experience.
It is a new experience for a lot of students, but I think it also gives them an opportunity to, especially with our virtual lab, for example, in our advanced coding courses, they can online get the experience of looking at actual patient charts for those of students in advanced coding, use some of the tools that a lot of our HIM professionals use in the field, such as an encoder, and put their learning together in the coursework, all from their home, which is great. So, so even though it is online, they still have an opportunity to utilize some of the skills that we need in the profession itself.
You know, it makes sense to me. I think if you're in a computer-based field, you should be doing training using the computer, I would think, right?
That's true. But we are also a community college where we give our students a lot of support. So even though a student is maybe taking classes remotely online, we're still available to them, just as we would be if you were taking courses here in a classroom. And we have some tools where we can give students assistance remotely. We can use our WebEx capabilities to meet with a student who isn't able to come to campus and give them any assistance that they need.
Okay. Well, it is time for a quick break here, listening to Middlesex Moments. And after our break, we'll learn and continue to talk about the Health Information Management program at the college and what an HIM professional can expect in their career. Again, talking to Elaine Ippolito and Jill Flanigan from the college's HIM program and Karen Lawler from the Hospital for Special Care. You're listening to Middlesex Moments, coming to you on air on WLIS WMRD Radio and online at mxcc.edu. Stay tuned. We'll be right back.
So the ODD program is actually a really interesting, rewarding program here at the college. It's ophthalmic design and dispensing, and we teach the art of opticianry, which is fabrication, fitting, dispensing of eyewear solutions, contact lenses. There's really a whole host of different job opportunities when you've studied in this field. There's a huge demand for our services for private practice jobs, corporate opticianry jobs. We work with ophthalmologists. We work in optometrists' offices. We are in a unique position in the state of Connecticut in that opticians can fit contact lenses. And because of that, a lot of our curriculum is based around the fitting and evaluation and dispensing of all sorts of contact lenses. And the students here learn on the latest and greatest technology. Topographers, slit lamps, have wet labs and hands-on. We practice on one another. It really gives you an immersive experience, and how you decide to fit in and what you decide to do, the sky's the limit. Some folks come to this degree program because they've been in the business already. They just want to learn not just what they're doing, but why they're doing, the science behind it. But other people have never stepped foot in an optical or an eye doctor's office in their whole life, and we can take care of that as well. Many of our students get involved with mission projects to volunteer with a nonprofit organization where we provided free eye care and free eyeglasses to a underserved population. There's a hands-on internship where you go out and work in the field. So not only you're getting the hands-on, but you're getting the community service aspect as well. We're the only opticianry program in the entire community college and state university system. And as a matter of fact, many of our full-time faculty are graduates of our program. It's been successful in that we've graduated, gone out, gotten the experience, come back and wanted to contribute to the program. This is the opportunity to get into a blossoming industry, and we believe this will give students the tools, the knowledge, and the background to be immediately valuable to a practice.
Middlesex Community College, your college, your future.
Welcome back to Middlesex Moments, coming to you from Middlesex Community College. This is Steve Minkler together with my guests, Jill Flanigan, Elaine Ippolito, and Karen Lawler, and we've been talking about health information, associate degree program and certificate here at the college, but also the general career paths that are available to students who are interested in this field. So Jill, as program coordinator, in a student's second year of the program, how do you start preparing them from the transition from classroom experience into the work world?
Well, towards the end of the program, we have a professional practice experience course where we're doing a couple of things. One is we're using the AHIMA virtual lab. It's the American Health Information Management Association virtual lab that gives us access to software applications that professionals use in healthcare organizations and enables the students to practice using those applications. Additionally, as part of that course, students will go out to a healthcare organization and have an on-site experience where they're going to see how people work in the profession. Karen has hosted students from our program. And we also have a certification exam preparation course that comes at the end of the program that gives students a little bit of review and preparation for taking that certification exam.
Preparing them perhaps for a specific job, but I think it's important to note that there are state, regional, and national associations for folks in this profession. And Elaine, you are currently a member of one board?
Right. I'm actually currently, because I came here from Massachusetts, I'm currently on the board of the Massachusetts Health Information Management Association. So we have a national organization called AHIMA, the American Health Information Management Association, and each state has their component association. So I belong to Massachusetts, and Jill and Karen are in Connecticut. In Massachusetts, I've been the secretary. I've been on the nominating committee. I'm currently on the communications committee. I edit their Connect newsletter, which comes out quarterly, and as the editor of the newsletter, I'm also on the board at Massachusetts.
And all three of you have been involved with the national organization too.
Yeah.
And
Yes,
in what
that's true.
capacities?
Advisory boards.
Advisory boards?
I'm currently a member of the Privacy and Security Practice Council for the American Health Information Management Association.
Great. So maybe if we back up a step a little bit, the purpose of these organizations is certainly a networking opportunity for people in the field, but it's also advocacy for the profession, both in terms of career advancement, I'm sure, but also in terms of, sounds like, directing policies and perhaps even changes in statute as necessary, right?
That's true. Both our state and national organizations do lobby for legislation that supports managing health information. And we provide professional networking and education for our members as well.
And Jill, we've had some events on campus where you have introduced students who are currently in the field to start to begin that networking process.
Right. We have a great relationship with the Connecticut Health Information Management Association, and we have been able to host some of the educational offerings for continuing learning here on our campus, which has made it a lot easier for students to attend and participate.
And I think it's also important for our listeners to know, too, that another element of having an academic program at Middlesex Community College is that our programs all have advisory boards. So we, are informed by groups like HEMA and CAHIM, our accreditor, but also people who currently are professionals, like Karen's on our advisory board. So what kind of individuals help us as a community advisory board for our program?
Well, we have a very strong advisory board. We have members from really most of the health systems in Connecticut that are working with us. We have members from software companies as well as healthcare organizations, and their input is really valuable in developing the program and where we take it. Really, we made the changes to our certificate program to enable students to receive the CCS or CCSP, Certified Coding Specialist credential, based on feedback from our advisory board that was really a needed credential in our service area.
And our program is an associate degree. Really, it's a 2-year degree, which definitely leads into a great job and certification. What if a student wanted to continue their education into the bachelor's degree?
Well, we have an articulation agreement with Charter Oak State College that is also a CAHIM accredited program. And when students continue on into that bachelor's degree program, they are eligible to sit for another AHIMA credential, the Registered Health Information Administrator, or RHIA credential.
Okay. And Karen, at a place like Hospital for Special Care, what distinguishes an employee who has one degree and certification versus the other? What kind of work is it?
It's the job opportunities that are available to them. So, excuse me, for example, for a coding professional, for one that's credentialed, their ability to move into a higher level for coding practice is there because of their demonstration proficiency for getting the credential. Also, there's other credentials that are available through AHIMA that once a student has achieved their RHIT or RHIA and is in practice, they can achieve a certificate in data integrity and privacy, which is a certificate I hold. And that also opens up other opportunities for somebody to go and get employed in a healthcare facility.
Okay, excellent. And Elaine, the program is growing here at Middlesex Community College and hopefully growing even more now that we have accreditation. So as you've worked with students who've gone through the program and have graduated recently, where are students finding jobs in this field?
I think that they're finding jobs in hospitals and healthcare agencies in the area. And I know recently we're actually being approached by employers for students that we haven't got the students in the field fast enough for them at this point.
Right.
So for the most part, it's healthcare facilities, it's physician offices, and basically any type of healthcare facility in the area is really looking for RHITs right now.
They are. And if I could just add, gone are the days where we could promote somebody from within. You would like to do that, but the skills needed are so very technical now, and the understanding and aptitude that having a student, a graduating student, is so critical and important.
Okay. So for somebody with an associate degree in health information management, what's the typical hiring salary range? What are we talking about here?
Well, the average salary for someone holding that credential is in the mid 60,000 range.
Okay.
So that's an overall average. For a first job, it would be a little bit lower than that, but that is the national average for that credential.
And I think it's going to depend on their experience. If they come in, I mean, we've had students that have been in the nursing field, or maybe they were in management in some other field, and if they already have the skill set to be a manager and they get this credential, then they have opportunities to go into management initially, whereas someone that's just starting out might need to get a little bit more experience in the field and then move up from there.
That's very true.
Yeah, because part of it, too, is also realizing that a health information management professional is part of a healthcare team. So there's,
Yes.
Are you familiar with the healthcare organization? And I know we teach that in the program, but I could see if somebody had prior experience and was maybe job shifting or career shifting into something,
Right.
I could see that being in play. But that's actually a very good starting salary for somebody with a 2-year degree. That's excellent.
That's an excellent salary, and really there are, once you hold a credential, you continue to have more opportunities, and because the field has different areas of focus. We mentioned privacy, we've mentioned things like revenue cycle, there's an information technology side to that. You have the opportunity to move around into roles that contain more or less of either of those as you wish.
Yep.
Yep, that's why it's really never boring, because
Right.
I always felt, even as a director, I never had a boring day, because if you might be focused on the legal side of things one day, and then you get into the revenue side and the clinical side, so there's such diversity in your day that that's what makes it, if you like that type of thing, if you don't just want to do one thing, I would say this is the field for you.
For
It
sure.
is, and the respect for our profession is growing,
Absolutely.
particularly with the knowledge that we bring. So I think that's important too. You really feel part of a team. And, again, not direct patient care in many cases, but you are part of that critical clinical team that's people find rewarding.
Absolutely. And as you were saying, it's never quite the same thing every day, and I think it's important to Well, I don't know if Karen, if you're aware of this, but I think it's important to publicly and on the air thank Jill and Elaine, since they both have backgrounds in library science. They actually helped our library here on campus last spring when
That's
we
a
had a bit of a
lost
staffing shortage.
Right.
So
It's
we're
a
going
lost start. That's wonderful.
to shift from one thing to the other dramatically. But we
Yes.
thank
Yes, we
you for
did.
helping with that.
We have many skills.
That's right. Maybe radio engineer might be next. I can't sit on this side of
Not
the
yet,
table.
no.
Well, as we wrap up, Jill, how can a potential student find out more about the program?
Well, they can contact me here at the college, and do you want?
Yep.
So my phone number is 860-343-5791, or they can email me at jflanigan, jflanigan at mxcc.edu.
And of course, our program is spelled out on our website at mxcc.edu, and you have to kind of drill down a little bit into the academic side
Right.
to find it. Right. And any last words, Elaine? You are a program advisor. What would you tell an incoming student who is interested in this program? Just somebody called you up and said, "Hey, I'm interested in HAM." What would you say to them?
Well, I think it's a great field. It's a field with a lot of opportunities, as I already mentioned, and so I think no matter what, and we get a lot of students that can't decide what they want to do, and I think probably all of us can agree that we were in that same situation when we found this field, and it's a great field for someone that's really not sure, because again, between the clinical, the regulatory, legal, and finance side of things, there's more than enough opportunities for you in this field.
Oh, it's endless.
Yeah.
Endless, yeah. It's
Okay.
great.
Great. I want to thank my guests for joining me today: Jill Flanigan, Program Coordinator of Health Information Management, and Elaine Ippolito, Assistant Professor of Health Information Management, both here at Middlesex Community College, and Karen Lawler, Corporate Director of HIM and Privacy Officer at the Hospital for Special Care New Britain. Thank you for joining me today
Thank you
for
very much.
Middlesex Moments. And I'd like to thank all of our listeners for tuning in to Middlesex Moments and our on-air media partner, WLIS WMRD, and all the great people at that radio station. As always, you're welcome to visit Middlesex Community College in person at our main campus at 100 Training Hill Road in Middletown, or at our Meriden Center located at Platt High School, 220 Coe Avenue, where we offer afternoon and evening classes 4 days a week. And of course, you can visit us online 24/7 at mxcc.edu. For everybody at Middlesex Community College, I'm Steve Minkler, and we hope to see you again soon.